All right. Good morning, everyone. Today, we are reporting 187 new cases of COVID-19 in the state. This does include 12 new hospitalizations, 0 new deaths, 102 newly recovered individuals to the point where they're no longer able to transmit COVID-19, and 1,482 new tests that have been reported. This does bring our total COVID-19 case count in the state to 13,509 cases. Of those, 2,730 are considered active infections, and 10,612 individuals have recovered. We have 76 individuals who are currently hospitalized, and 167 total deaths. We've had reported a total of 192,432 total tests to the state of South Dakota with COVID-19 results, and that has been among 146,529 unique persons. I just wanted to provide a quick update on the community impact map that is updated today on our website. You can see that we have 9 counties having no community spread, 23 having minimal, 19 of those having moderate, and then 15 counties having substantial community spread. The other update that I'd like to provide is that we have the total count of Sturgis Rally cases among South Dakota residents, and that is where a South Dakota resident had attendance at the Sturgis Rally prior to becoming ill with COVID-19, is at 105 total cases. And last but not least, just wanted to let folks know that the K-12 school and college update will be coming out a little bit later today after I finish reviewing those numbers. So, with that, I'll turn it over to Secretary Melson-Marston.
Thank you, Dr. Clayton. The only update I have for folks today is that as of the weekly report that ended 8/30 of 2020, we've seen a 33.1% reduction in deaths due to COVID-19 compared to the prior week. So our death rate is, in fact, in a downward trend.
All right, I will go ahead and unmute our lines, and then we will take your questions.
Hi, JP at KORN News Radio.
Go ahead, JP.
Yes, our school district in Mitchell usually sends out an update on Friday regarding cases. But our administration had said that they didn't get numbers up till Friday from the health department. Was there some sort of delay in getting those out to the districts?
So, JP, this is Kim Alson-Risden. The way that works is we provide the information to the Department of Education to be put into a format to help schools understand the case numbers, and there was a problem with the platform that was being used for that. So if that hasn't happened over the weekend, I'm sure it's going to be happening very soon.
Yeah, and
thank you.
You're welcome.
Just wanted to say that those numbers should be out, so we're good to go.
Excellent.
Next
this is
question.
Morgan from the Journal.
Go ahead, Morgan.
Can you give an update on any other states that have reported back to South Dakota about people that went to Sturgis Rally but now have COVID?
So, we have received a few additional notifications of cases. I don't have that information readily available. We do have a couple of additional notifications from other states, but I don't have the tally of specific cases that have been reported to us. And again, we do focus on providing either a direct notification to close contacts that have been identified from those out-of-state cases, as well as assessing for the need for a public notice when there is not a way to identify all of those close contacts.
Okay, and I have another question for you guys. Monument Health sent out a letter to all their staff on Friday night, telling them to prepare for a surge in cases. Not sure what it was relating to, but 60 staff members had tested positive for COVID in August alone, and more were self-quarantining. So I'm just curious if there's a Department of Health response to this, or like what kind of preparations would need to go into a surge like this, if you could maybe explain that.
Well, I think there's a surge need at any healthcare facility where they've got healthcare workforce that aren't able to be providing care. And so I believe Monument was trying to inform their employees so that, if work schedules need to change and, folks need to perhaps work a different schedule than originally planned, that people would have notice of that.
Next question.
But is there anything in the Department of Health response that you would need to, help them in any way, give them any aid or any guidance, I guess? I don't know.
Sure. So when we do see positive cases associated with healthcare facilities, including nursing facilities, we proactively work with them to make sure that they've got enough PPE, that they've, are able to employ mitigation strategies such as cohorting, if we're talking about residents or patients, and some of the things that we know can help minimize the spread. So, those offers of assistance are out there for any healthcare facility experiencing COVID.
Next question.
Todd Epp, Kello.com News.
Go ahead, Todd.
Thanks. This kind of dovetails a little bit on what JP asked. Apparently there was some problem with the reporting system for the K-12 schools and universities and getting that information out. And then last week we had the problem with a bunch of numbers, a bunch of positive cases being dumped in to the system. I guess that was Thursday. And then Iowa, and I know you have no control over Iowa, but Iowa again reported problems with their system, and they had reported some major systems and problems in their reporting system in last month, or I believe in July. Whenever I post any of our stories from any of the local departments of health on coronavirus numbers, I have a sizable minority of our readers and listeners that doubt the accuracy of those numbers because of the various problems. How can you assure the public that the numbers that they're getting from you all are accurate and in no way cooked or otherwise, that these are the numbers and this is what they are?
Well, Todd, this is Secretary Malsom Risden. I think our track record speaks well of the fact that we've provided accurate numbers consistent with what people are experiencing across our state. And when we have, any kind of issue, we will correct that and be transparent about that. We're gonna see issues from time to time. We have many redundancies built into our systems, which is exactly what helps us catch if there is some kind of reporting issue that we need to resolve. The other thing I would just tell you is that these systems are relatively complex. They're used for a lot of different functions as part of our COVID response. And relative to the issue that we corrected on the website last week, those numbers did not impact our ability to contact positive cases and conduct investigations. So the part of the problem with our system was specifically on the public-facing part and did not impact our operations for our COVID response. So the other thing I would tell you is that there's people that don't like the numbers, and so, they'd like to think that maybe they're not true because they don't like them. Our duty and our resolve will be to provide accurate numbers regardless of what they are.
So what can we do in the media to help get that message across? I can't give you a percentage of people that are skeptical, but there seems to be a sizable number of citizens that are skeptical of the numbers that not just the Department of Health releases, but the national numbers and so forth. What's the role that you think the media should play and your department should play to try to tell people that yes, these numbers are as accurate as we can possibly get them?
Well, I would just offer one thing, and that is, to really, to the degree that there are people that dispute the official numbers, which you will find on the DOH website here in South Dakota, what their facts are to dispute those. And we hear all kinds of theories around, you know, cover-ups of data at the federal level, and more often than not, when we can get the information that people are relying on, then we can help educate them as to, you know, what they're not considering in terms of those numbers. And so, you know, I think really fact-checking some of these folks that say, I don't believe the numbers, and making, you know, trying to understand the facts that that's based on.
And
Great,
this
thank
is
you.
Dr. Clayton. I think one of the other things that I'll just go ahead and add in there is, you know, when we're dealing with just the you know, unprecedented situation that COVID-19 offers, you know, I think individuals have you know, perspective when it impacts them, when they know individuals who have been impacted by COVID-19. But, you know, when we're putting up numbers, you know, of having, you know, 13,000 cases of COVID-19 just within the state of South Dakota, you know, it's sometimes even that sort of mentality is difficult, that number is difficult for people to reconcile. You know, we don't have many other conditions that we deal with where we would have that large of a number in such a short period of time. And I think, you know, just dealing with and providing, you know, the basic science around COVID-19 and how it's transmitted, and, you know, when we're talking about a case versus somebody who's recovered versus somebody who has had a test, you know, helping reinforce what those really mean, and so individuals can help to put those building blocks together so that they understand what those numbers are and better understand how that impacts both the state of South Dakota, their local community, and the country as a whole.
Next question.
This is Mark from the Pioneer.
Go ahead, Mark.
Last week there was a Lawrence County death reported, a gentleman in the 80-plus age category. The death certificate was signed 2 weeks prior to that. Just curious as to why the delay.
So thanks for the question, and we are still looking into your request to get a little bit of an explanation on that. So we're working with our Office of Vital Records as well as taking a look at our internal processes just to see, you know, how long it took to get through each of those steps. And we'll follow up with you.
Next question.
Hi, Ray from Keloland.
Go ahead, Ray.
Hi, you mentioned the decrease in the death rate. Can you give us a little more details on that? How it's calculated and what the death rate is right now?
So yeah, I mean, overall, when we're looking at the death rate, it's based on the just number of deaths that have been identified within a specified time, you know, over the population. And so, looking at it, you know, week by week, you know, we have seen a little bit of a decrease, you know, in comparison to a prior week, and so it's. One of the things that I would, you know, caution is that, you know, while it's good news this week, you know, we want to make sure that individuals realize that we have increasing number of cases as well, and so that we do anticipate that our death rate, you know, will increase in the coming weeks with all of the individuals that we have identified with COVID-19 in the state.
Okay, so just to make sure.
Go ahead.
On that, so you're calculating it based on population. Did I hear that correctly, or is it based on the number of cases? Okay.
The rate is the rate of death per 100,000 in population.
Correct.
Okay, and then do you have a percentage? Because you mentioned 33.1%, I think, decrease recently. Is there just a flat percentage that you look at as of today or as of last week, or?
Well, that's a week over week kind of calculation.
Yeah, and so, yeah, again.
That would be the most recent.
Yeah, and we do look at that on a weekly basis. So, yeah, increases or decreases between that previous week's overall death rate versus the current week's. So, yep.
Okay.
Next question.
This is Morgan at the Journal. If I could ask another question.
Go ahead.
I emailed you back and forth about this earlier, but I'm curious if you could maybe influence the Board of Regents or universities or someone to start sharing the total number of cases in our universities The majority are sharing the active cases, which is helpful to know every day and to make those decisions, I'm sure. But to know also the total number of cases would kind of give us more of a perspective of how much of campus has been affected. So I'm just curious if you can explain why different numbers are being shared, I guess.
So Morgan, I think you really do need to address that question to the Board of Regents.
Okay. Sure.
Next question.
This is Jonathan with the Argus Leader.
Go ahead, Jonathan.
There's been a fairly healthy, significant increase in cases and people in the 70+ range in the last, I'd say, 5 days. Are we seeing another nursing home cluster, or is that very widespread?
We do see cases in nursing homes, and when we do, we work with them very closely to conduct a point prevalence survey so that we can help identify any additional cases very quickly, and in the attempt to intervene and avoid any ongoing spread within those areas. I think typical of what we've seen with increasing number of cases, that it does increase the risk of transmission, among staff, and then spread of staff case infections to residents. So we are very watchful of the situation, and the numbers do reflect the increases that we've been seeing in some of that population.
Next question.
Scott Ingen, Dakota News Now.
Go ahead.
So regarding deaths, the CDC put out a report saying 6% of deaths were attributed to only COVID, and that's been circulated on Twitter and some social media platforms. And I was just wondering if you could shed any light on to what that 6% number actually means, and if it's if there's other things around that 6% that people aren't understanding or that need to be said with that number.
Right. So that's a great question. I'm glad you're asking that, and this would be a great thing for the media to help us get correct information out about. I'm just going to make one comment and then turn it over to Dr. Clayton, but the literature is very clear that individuals who are elderly or who have chronic underlying health conditions are very susceptible to poor outcomes if they also contract COVID. And so it's not as easy as to say, if you have an underlying health condition and you also have COVID, that somehow COVID did not play a role. And so we do see that very commonly where individuals have underlying health conditions, they contract COVID, and COVID is part of the cause of death.
And so when we're looking at individuals who have died, and you're looking at that, primary, the underlying and the contributing causes of death, just because only 6% of those cases that COVID-19 has been listed, that doesn't mean that the other 94% are solely due to the other conditions that are listed. As Secretary Malcolm-Ryston mentioned, when we have individuals with different comorbid conditions, that increase their risk of severe COVID-19 infection, that does play a substantial role in their overall, risk of death. And so it's something to keep in mind that when we're looking at causes of death, and this is just in the general population, that we are not often seeing single cause alone. A lot of individuals have a lot of conditions, they're chronic conditions that ultimately do play a role in their death. And so just something to keep in mind that that 6% is being taken out of context, and that that should not be viewed as those are the only people who died of COVID-19, but it is a smaller subset where that was the only identified cause that was the cause of death. Yeah.
Next question.
Ray from Kellerland.
Go ahead, Ray.
I know that you guys don't specifically track this, but are you hearing any information from any medical care providers about some of the lasting impacts of COVID, even some of those who might have mild symptoms or have a mild case, so to speak. I mean, there's more reports of folks having some neurological problems, the cardiac problems that sometimes manifest later. Are you getting any anecdotal information related to that or hearing about that?
Primarily what we have seen and heard is really what's being relayed in some of the national literature around the peer-reviewed journals, looking at some of these longer-term sequelae. The focus that we've had is to conduct surveillance for a multi-system inflammatory syndrome among children as one of the examples where, after the infection has passed, where we have individuals who are having, essentially their organs, systems shutting down and causing some severe impacts and even death among that younger population. So we continue to monitor the literature and monitor the situation as it evolves. And again, we're still understanding all of the impacts of COVID-19, and so I anticipate that we'll continue to have more of that come out in terms of impact to individuals who have symptoms, as well as those who have asymptomatic infections, and what that overall impact might be.
All right, we have time for one final question.
Scott Ing in Dakota News Now.
Go ahead.
I know you guys kind of talked about this a little bit already with the infections of younger folks, but with how many cases we're seeing in the younger demographic, I mean, is that a concern, and is there a message to that specific demographic right now as we continue to see our cases climb in South Dakota?
I think the biggest thing, and that's to that younger population, as well as the parents of younger children, is anytime that you can take the opportunity to reinforce hand washing, hand hygiene, and general prevention measures such as covering coughs and sneezes, that does play a huge role in decreasing overall transmission, as well as helping your child appropriately wear their masks, whether they're in just general public settings or whether that's the choice that you make for your children going to school. I think those are important pieces to preventing transmission and potentially seeing those sequelae arise.
All right, thank you for joining us this afternoon, and just a reminder, we will shoot out a social media post when our college and university weekly report is ready to post today. There was a slight delay with that, and we'll get it posted this afternoon. Thank you.